Facebooked him, can I give her a discount? And he's all, only if she says your name.
There we go.
Yeah, it worked out well. But you have such a great reputation in the area, and being in Plano now all these years.
Thank you.
I think, okay, so I never really cared about facial plastic surgery. I'm going to be honest. But now at 47, I'm starting to care.
You look too good.
Thank you. Well, I'm starting to, like, when I lost the 25 pounds, all of a sudden I gained wrinkles, and I'm like, oh, do I need to gain some weight? I'm like, this is not good. And so, of course, being in Iraq, exposed to chemicals, I have a really hard time with chemicals. Although I have Botox right now, I only have 10 units. And the reason I only do 10 is that I do have weird reactions to it where I just don't feel well.
Interesting.
A little bit of a blurred vision. It normally lasts for about a week or two. But so I can't even tell you that I'll be able to continue to use Botox.
Are you drinking vodka while you're doing it?
No, I'm not drinking vodka. It's so weird. And so, but you know what? It's a very small number of people that I've even talked to that have had any problems with it at all.
Yeah, I've never seen that before. It's interesting.
And that's what most surgeons have told me, that they have not seen that. And so I don't know, but that's with a lot of chemicals, not just Botox. So I'm always kind of scared. So that's why I have not done anything else. But anyway, on the plastic surgery side, this is what I figured out. I can take stuff out and stretch stuff and I'm good. But it's a little harder when I put stuff in because my body's allergic to it. I would be that girl that would do breast augmentation, put it in, and I'd be allergic and they'd have to take it out. So I'm not even going to try that. So, but anyway, so for me, for instance, at 47, and I know a whole lot of people in my boat when it comes to the face on what we can do, why we should do it. For instance, someone told me she got a brow lift and she looks amazing and she's not having to use Botox. So, but I don't know the difference between brow lift, mini facial,
my
regular
had
facial.
An eyelid lift because they were sagging, and that was more of a medical thing, but it ended up making him look younger too.
Interesting. So do I just need to wait till my eyes go over there and then get it done and have insurance pay for it? Because that's happening to me too.
The best way for me now to explain this is that I look at the brow like a balloon. So if you think of a balloon that starts to deflate, and that deflationary process that goes on makes it look gravitational, looks like it's sagging. So personally, I have not performed a brow lift in over a decade, and I think to me it's an old paradigm. Okay. So when you look at the brow and you start to see how it changes, if you go back and look at your brows when you were, let's say, 20, you're going to see that they were fuller. And so when you see the deflation, it starts to sag. So what I do in most cases is I do take a little skin away as needed, only when it starts to really sag a lot, and I put a little volume back in with fat grafting or non-surgical methods, and many different ways that you can do that.
Okay. So you just take a little skin off. Where do you take the skin off at?
It's inside the crease, so it hides extremely well.
Okay, so, you mean on the eye, like in the crease in here?
And the key here is that you got to be delicate, and this is not just
because it's the eye, right?
Yeah, hello.
Well, the key is people don't want to handle recovery times, and so with my fat grafting, there's recovery. You're going to look pretty swollen and not as good as you would like for 7 to 10 days. But with my eyelid procedures, if you do that, I can do that completely awake in the office with some numbing cream, and believe it or not, you're going to have very little discomfort. And I really, honestly, and it's not just saying this on the radio, I get extreme little bruising, very short recoveries.
That's incredible.
Wow. Yeah.
Yeah.
I'm going to ask the same question that I asked Vaughn about, kind of makeover on the house.
Yeah.
What's the one treatment that women can do right now that, like you said, there's very little recovery? It makes the biggest bang for the buck. What's the big thing
on the plastic surgery side?
Right.
Yes,
right.
on the plastic surgery side.
Right. There's a full spectrum of everything from non-surgical to surgical, and I think that it just depends on the person's age. So if they're small, they can start with smaller things.
What can I do?
It's too late, my friend. It's too late.
Look, you're going to have to pay for that consultation, Carmine.
No, that's good. We're on the clock. We got 12 minutes. Go.
No, fat grafting, as we talked about earlier, is actually amazing because it restores lost volume. But there is a limit at a point where I would say someone is getting into maybe their mid-50s, mid-60s or so, and there's actually gravity. So there's a mistake that we think that volume covers all sin, and it does not. It doesn't cover wrinkles.
Right.
It doesn't cover gravity. And so when the jawline and the neck start to sag, then that area is an area that can be lifted. Now, what's interesting, in my opinion, is that the outer lateral face, where if someone doesn't do a lift, I put fat on the outside to create a better shape. Because when you look at someone from a casual distance of 5-10 feet in a few seconds, you can tell, even across the room, what their age is, and it has a lot less to do with wrinkles than shape.
Interesting.
But with lifting, if something is sagging, then a lift really is what is necessary. But what's interesting with a lift, it can actually simulate volume or the lost volume of the outside of the face when it's resuspended. So.
That makes sense.
I can get to too much detail, unfortunately.
Yeah, but
no, it's very interesting.
You were talking about the fat replacement, but we didn't go into detail. So what is that?
So basically, what it is
take it from your hiney.
That's
That's where the most fat's at, right?
Take mine right now.
I jokingly call myself Robin Hood because I rob from the rich parts of your parts of your body and give it to the poor areas. So it's facial socialism. No, I'm just joking. No, but it really what it is you take a little bit, you suction it out because the fat acts like a liquid. You take it out from the belly or thighs. You don't need a lot actually, just very very little. And the key thing that I want to really emphasize to the audience out there is that what you see around town is too much in the cheeks, right? I mean, you see these people with chipmunks all over the place, and I think that should belong in the animal kingdom. So the trick when you add volume, I won't comment on that. Play the fifth on this, but the trick here is to avoid areas of dynamic problems. Like when you smile, it gets too much in the cheeks. So that's why I focus really around the eyes and the outer face. You're very safe.
Okay.
No, he's right because I do immense amount of retouching
but not on me.
No.
Yes, on me.
Very little, very, like seconds worth.
I don't want to look like a cartoon.
And I just got done retouching and I'm not going to say who it is. Let's say one of Jennifer's clients like that.
What?
And she needed nothing, of course.
Yeah.
But I can reshape the face. I mean, take the cheeks in it, and they're like, "You're a god." I'm like, no, this is fake. And now you take this photo and take it over to, the doc, Sam, and make it for real. He'll tell you if he can do that for real or not, because, and you were saying about doing too much or too little or, it's an art, what you do.
And it's also, this is sort of fun. If you ask women when you ask them, hey, when do you think you look the best? A lot of my female patients don't tell me, oh, as a teenager or 20, because the face at that point is very round and very full. A lot of women tell me early 30s or mid 30s. And the reason for that, if you think about this, think of a 1-year-old. A 1-year-old is robustly full of fat. At about 5 years old, it's less, 10, 15, 20, 25, 30. So if the weight is maintained, if you go all the way to 80 years old, besides gravity and wrinkles, that volume continues to contract. So that sweet spot of where you think you are the best, you subtract 5 years and you look too full. You add 5 years and you look too empty.
Interesting.
So there's math.
There is.
So I think isn't
not
there
higher math though.
There's something to be said, I think, about gaining and losing weight.
Yeah.
So when I lost the 25 pounds, that's when these lines got. But the good thing is when you smile, then you can't see that you have them. So good thing I smile. I'm just going to go around like this all the time. But I hate this, and so then I see facelift, and it scares me. I think that you can actually show too much, and it's a little scary when I see someone's skin taken off their face and put back on. I'm like, oh dear, I shouldn't have watched that.
No, the incisions I use for a facelift are actually quite small. They're just around the ears. And as you know, one of the biggest concerns people have is, what does the incision look like? And so I say there's no hair loss. Very small, and in curvilinear, the key with curvilinear, meaning not straight, is that if you can hide those into little zigs and zags near the ear, you just can't see it.
Brilliant.
So,
I told you about using big words around me.
Yeah, I'm sorry.
Do you want me to get the dictionary for you, Carmine?
Va bene. Mi
dispiace.
Okay, we're not going to do it in Italian. Sorry.
See, the thing about Sam or Dr. Lamb is not only he is the expert at what he does, and he, to me, I always tell people when they say, well, why should I go to Dr. Lamb? And I said, because he specializes from the face up. He doesn't do everything else. And you have to really be specialized in what you do best, and that's what he does. But not only that, he's an artist. I mean, he has an eye that can, because I want to go to, when I need, which now,
no.
I go to, Dr. Lamb, I would say, can you tell me what I need? And he's honest enough to tell me, but then he has this artistic eye that says, you know what, but this is, I think we should, twitch a little bit here, twitch a little bit there. And he's honest enough not to say, oh, you need everything.
Yeah.
You know what I mean?
Yeah.
Exactly.
And that's what I worry about, plastic surgeons, any kind of surgeons, just selling you what can I get out of them, and you see that walking around all the time. You see the people that took it too far, and then you look at them and go, that's the doctor not saying no.
I think also, I always say this, I think, my patients have to have good taste. So I like patients that have good taste. I refer patients with good taste.
Right.
And I just told the patient this morning, I said, hey, you know what? If you bring me a friend that looks weird and they don't know they look weird, I'm going to tell them they look weird, because I have a real big passion to make people look better and not insane.
Right.
So I said, so I had a friend of mine, I'll be extremely vague with this, so it isn't, a friend of mine that said, hey, I'm going to send this woman to you. Her lips look insane. I said, does she know they look insane? She goes, no, she loves them. I said, well, we're not going to have a good relationship.
Right.
No.
So just keep her at home.
There's a lot of honesty at this table today.
You know what? I absolutely love the honesty, because I actually have a friend as well that looks like she just really went to the wrong plastic surgeon, and facial plastic surgeon. I mean, it's bad. Like, her face is frozen. It's bad. And so I actually, having so many doctors, surgeons, and dentists representing them over the years, I've had quite a few plastic surgeons. And one of the plastic surgeons said, can you please not invite her to my events anymore? Because I don't want anyone to think I did that. And I'm like, uh-oh. But she thinks she looks fine.
No, and I had one lady that had really large lips, came from another city, and I begged her to help me dissolve those lips. And so I did that, and she just was very sad for about a month. But she said, because she was adjusting to it. Then after she started looking at all her friends looked insane, she goes, thank God Dr. Lamb not forced me, but really urged me for a while to do this. And so I think that's important.
You were honest with her.
Not everybody has good taste.
Yeah, I have to say, this is I always jokingly say, and I don't mean jokingly, I really quite seriously say, you're paying me for my taste.
That's right.
Because I really want to help you. And I really love what I do. I mean, every day it's actually joy to go to work. And I love designing no matter how I do it.
Right.
So the big thing is my patients and I have a really good relationship, but I'm going to be honest. I'm going to be blunt with you. And I think you're spending a lot of money with me, and I don't want to be rude, but I want to help you. And if I'm not honest with you, I don't think I can help you.
Right. I love that. So on a facelift, what is the big difference between a regular facelift and a mini?
Right. So I'll tell you marketing. But I will tell you,
Jennifer.
Hey, I know marketing.
I will tell you, I've done facelifts for many years, and I've tried every variation. I've tried to even do little tiny threads and things like that. They simply don't work. Even if I do an incisional facelift, if I don't release 4 key little tiny ligaments, it's called a modified deep plane lift, you simply don't get sustainable results. So in the past, I would do even a full facelift, and I couldn't get a sustained result. And now I realize these little ligaments hold everything. And what's magical with this is if you release these few little ligaments, which is very easy to do if you go to a skilled surgeon, that you don't need to pull. There's absolutely no pulling. The tissues fall back on themselves, and that's just mind-blowing.
Interesting. What's the downtime on, so if there's not a difference between the two, mini facelift is cheaper.
Yeah. And
so should we go for the mini?
Expensive.
Sorry, less expensive.
So the mini facelifts just don't work. I mean, now here's the thing. My incisions are as small as a mini lift. They're not longer than a mini lift. And my recovery is very fast, typically about 7 to 10 days. Wow. And the real thing is that it's very gentle. For example, I just had a patient come from another doctor's office. I was taking out the stitches, and my staff said, hey, I've never seen your patients look like this at a week. And the reason is that, the thing that my mentor taught me says, Sam, you know what? The key thing is be gentle as a surgeon. Gentle hands cannot be traded for any amount of ice.
Really?
Yeah. So I love what I do, though. It's fun. And if you're gentle with patients and do what we can do for them, you can deliver awesome results.
Okay.
Yeah, it's amazing. I just got back from the San Diego National Convention for Dermatology, and there was so much overdone there. It was, it was a couple 100,000
that's the epicenter.
Square. Yeah, it was in California. It was in San Diego.
Oh,
So it was a double whammy. Like I went with my other half, Beverly, and
she's on. You better say hi to her.
Who's gorgeous and has had nothing
Bev.
done. You know. Yeah. And she's going to want your number, though. She's always, I'm like, leave it alone.
I tell you, before I go to these conventions, I have to take anti-nausea medication because I look at all
it's not only the women walking around, but it's the women in the doctor's offices who basically get probably a good price on it, and they go bananas on it.
Well, I'll tell you, this is the key thing. If you go to a doctor's office and you're trying to shop around and figure out who's good, besides looking at the before and after, just look at the staff.
Yeah.
If the staff are insane, you better run out. Make sure the doors are not locked.
No, I agree, because Jennifer, she's my main referral on doctors, because that's what she deals with a lot. And I go into some of these offices, and just like you said, whether it's dental or facial or whatever the type of doctor is like that, you can see if that doctor has overdone it or not overdone it, and then what you're dealing with.
Well, I always go back to, so I like everything dramatic. I always say dramatic but classy, because there is that line of it being overdone.
Right.
So I think the same thing with makeup. I like dramatic makeup, but I don't want to look like, remember that lady on TV, Mimi? That had blue eyeshadow and pink like up to here. So like I don't want to look like that, but I still like dramatic, long hair, makeup, clothes and everything. But there is that fine line of it still being classy and real. I don't want to not be able to move my face.
Right.
When even at 47 right now, I'm supposed to have a little bit of wrinkles. You know what I mean?
Yeah.
So, but I think there's just that fine line, even with extensions. I do put extensions in my hair, but the girl that does my hair blends them all in, and most people don't even think I have extensions. But the difference between Jennifer in her 20s and Jennifer at 47, my hair's not as thick as it used to be. You know what I mean? So things start changing, like dyeing your hair a little bit. The people, I can tell that I must not look 47, not because I don't.
Amazing.
Thank you. And I'm not trying to brag like, oh, I look so good, but I think I've learned all these little tricks because I want to look good. Mostly because, well, even if I didn't do what I do, I'd still want to look good. But I want to be able to do that. So what are some of the things, in my opinion, to make women look younger? And what I've done, there's all kinds of little tricks.
Sure.
From getting sleep to white teeth to a little bit of Botox in my head to getting surgery, plastic surgery when you need it, to the way you dress, to the way you put on your makeup. All those little things make a difference. Drinking water, like I pretty much only drink water. I don't put very many toxins in my body anymore, because that as well changes the way you look. People tell me all the time, oh my gosh, your skin is so good. Do you know why? Because I sleep, I try to keep away from the stress, and I pretty much only drink water.
Right.
And put moisturizer every single day since like my 20s. So those little things help keep you to look younger. But there's going to come a time where all the little tricks aren't going to work. So that's what I'm like.
It's working for you right now. So
thank you. I appreciate it so much. Coming from a facial plastic surgeon, that's a huge compliment. Good thing it's all being recorded. So I'm going to come talk to you soon, though, because
Me too.
I'm getting to that point. But we need to go to commercial break. We'll be right back. Thank you. So for sure, I'm like, okay. I'm like, what other tricks? So can you think of, since, we're still live, can you think of any, what's the word I'm looking for? Advice or little tricks when it comes to like, how would somebody, okay, so for me, example, I'm just trying to think out or brainstorm out loud. What could I do or what should I do without coming in and doing a consultation? To get rid of these with like plastic surgery, would it be time for a facelift for me yet?
No, the facelift won't help those lines. Fat grafting won't help those lines. They're really office-based procedures.
That's what I was going to ask.
Yeah, they're office-based procedures that can help. But my thing that I always try to educate my patients about is to avoid sun. Now, I know that's a dirty thing to say.
That's what Dr. Ramsey just said.
But I'm not a dermatologist.
Good.
Spray it down. But I mean this from my heart because, I always jokingly say you see Dr. Hopkins, you go to see a dentist, they're going to tell you don't eat candy, right? So I say this line every day. I say, I'm going to tell you don't get in the sun, or at least try to avoid as much as you can, because even a sunblock is like, I say, it's like smoking a filtered cigarette. You still get some damage there. So try to, as you said, sleep, nutrition, exercise, stress reduction, rest. But also, diet is huge. But also, in addition to that, is just minimize direct sun rays. If you're a runner, go early in the morning. Do something. Carry your mace, though. Anyway, so that's my big pearl.
Okay. And you know what? Dr. DeRamsey, Jennifer DeRamsey is a dermatologist up the street. And she's like, they have a new sunscreen that I forget what it has in it, zinc or something like that. And I go, well, do you get a tan underneath? She goes, no tan. And I'm all, what? And I was like, look, I look like a marshmallow right now. What color?
Well, it's funny. My wife calls this thing the Asian hat, and my mom has one of these too. It's not the rice hat you're thinking about, but this visor that arches out to like this.
Oh my gosh, how funny.
It's pretty funny. I'm sure if you Google Asian hat, besides this one, you're going to see this thing that sticks out.
Did you say Asian happy?
Hat.
We're on air here, okay?
Keep it clean, Carmine.
You hear what you want to hear, right?
You do. He's
Holy
crazy.
moly.